Chronic rhinitis diagnostics and treatment plan. Differential diagnoses. Chronic sinusitis, ICD-10-CM diagnosis code J32. The patient reported inflammation of the paranasal sinuses and nasal mucosa that has been lasting for 3 months. The presence of such inflammation for at least 12 weeks is a sign of chronic rhinitis. The other symptoms that point to this condition are the presence of nasal congestion and nasal discharge. Sinusitis can develop due to infective and non-infective causes. Allergic rhinitis, unspecified, ICD-10-CM diagnosis code J30.9. Airflow obstruction is also a sign of allergic rhinitis. However, in many cases, it is accompanied by such symptoms as sneezing, nasal discharge, mainly clear, and nasal pruritus. This is a likely diagnosis because allergic rhinitis is a very common condition in the United States, and it regularly affects at least 1 in 6 adults. Churg-Strauss syndrome, ICD-10-CM diagnosis code M30.1. The complicated breathing reported by the patient could also be a sign of the inflamed blood vessels in the upper respiratory tract, pulmonary eosinophilia, which is the major sign of Churg-Strauss syndrome. Final diagnosis, chronic rhinitis, ICD-10-CM diagnosis code J31.0. The patient reported nasal congestion but did not mention sneezing, swelling, and watering. The latter are the symptoms of allergic rhinitis, while nasal congestion without itching and the aforementioned signs indicate that the patient is affected by non-allergic chronic rhinitis whose symptoms often develop in older adults suffering from the condition. Plans. Chronic rhinitis plan. Further testing, in-depth assessment of nose, eyes, ears, and teeth, examination for inflamed tonsils and pharyngeal drip. Medication, nasal steroids are the usual approach to the treatment of sinusitis. Stop taking Afrin and replace it with nasal spray for the minimization of symptoms and azolastine. Education, inform the patient about the importance of timely visits to a doctor in order to avoid the development of a chronic form of rhinitis. Non-medication treatments, stop using hypertension medication currently taken, Afrin. Follow-up with the physician in 7 days for a new assessment. Chronic sinusitis plan. Further testing, MRIs or X-rays of affected areas. Medication, amoxicillin for 2 weeks, 250 to 500 milligrams, 3 times a day. Education, inform the patient about the harm of self-medication because not all medications for nasal congestion are equally effective. Non-medication treatment, keep nose cavity clean using salty water. Follow-up with the physician in 7 days. Allergic rhinitis plan. Further testing, allergy testing. Medication, Zyrtec, every day, 10 milligrams, current hypertension treatment continued. Education, inform the patient about the importance of avoiding allergens that can aggravate the condition further. Non-medication treatment, staying away from allergens. Follow-up with the physician in 3 days for an assessment. Churg-Strauss syndrome plan. Further testing, assessment using the list of Churg-Strauss syndrome criteria, at least 2 or 3 should match. X-ray and blood test. Medication, prednisone, 40 to 80 milligrams, lowering the dose gradually. Education, inform the patient about the purpose of the treatment and the condition. Non-medication treatment, keep nasal cavities clean using salty water. Follow-up with the physician in 3 and then once again in 7 days. Self-assessment. The assessment of the patient went normally. The patient appeared and presented his chief complaint. He was inquired about his condition and then examined based on his complaints and the standard guideline for patient assessment. The information was sufficient for the formulation of differential and final diagnoses. Urinalysis and blood tests were still pending, however, their completion could provide more important information.